Hi, welcome to another edition of Bringing Hope to Alzheimer's. I'm Ann Frazier, and today we're going to be talking about hormones. And so, as many of you guys have heard my story before, but I had in 2015, I had an emergency hysterectomy where they had to take out all of my plumbing. And with that, we found out that I had a lot of complications after that surgery, and I ended up having 6 surgeries in 7 months to fix all the things that went wrong during the hysterectomy. Totally different story. Anyway, after I kind of got through all of that, because of all the other surgeries and so forth, I had gotten a blood clot. And so my doctor had told me, you're never going to be able to be on hormones at all. You're done, never going to be on hormones because you had a blood clot. And I had a blood clot because I was laying down totally horizontal for 8 months trying to get through all these surgeries. Anyway, I started having massive hot flashes and night sweats, like debilitating. I mean, I would be sitting here just dripping. And it was zero fun, and it was really starting to affect my quality of life. So I went to a doctor for the first time who was a functional medicine, integrative medicine doctor. And I went because of my hormones. And those of you who know my story know that's when I also found out that there's hope if you're having cognitive issues, which I was, that I had not spoke about. But I want to focus in on the hormones today. So after we did a lot of testing, and to test your hormones, they did, of course, a blood panel, but then they also did the spit test where you have to spit at certain times of the day and put them in the tubes and freeze them, and then you send them off, all the things. So I did that as well. And when we got those test results back, post-menopausal, there are 5 what they call sex hormones that you should have certain levels of. Well, I had less than a trace of all 5 of them. So that is estrogen, progesterone, pregnenolone, testosterone, and one other one. And I can't think of it right now, but that's okay. So it's these 5, though, that you want to have a certain level. I did not have those levels. So what happened was that was our first, when we set out knowing that we tested all these things, because they're going to test your poop, your pee, your spit, and your blood if you're doing cognitive testing type things and you're trying to figure out what's happening inside your body, what nutritional deficiencies you have. But after testing all of that, we came up with a plan. And the number one thing that was glaring, we had a lot, but the number one thing that was glaring was my hormones. So because I had less than a trace of all 5 of these, that is a huge cognition issue. And so we immediately went to, because again, I had a blood clot, and we decided to go as natural as possible. So we ordered my hormones through a compounding pharmacy who makes them with she set out a kind of a recipe of where we wanted to start. And so we started with those, and we tried to get those hormone levels up to a certain point. After about 6 weeks, it was almost like I started realizing I haven't had near as many moments or what I would call brain cramps or whatever as I had been having. It really started to affect me. And we would test my blood and be like, okay, let's tweak it again. So we tweaked it again. And so we're constantly tweaking my hormones to try to keep these 5 levels where they need to be. And remember, when you're talking about brain health, you're talking about when somebody says, this is normal range, you're looking for optimal brain health range, right? So if this is normal range, but this is optimal brain health range, then that's kind of where you want to sit. So that's why it's super imperative that you're going to a doctor that understands brain health, the hormones, and all the things that the RECODE protocol calls for. That's the plan that I follow, that Dr. Dale Bredesen has put forth. But my doctors and I, we're testing my hormones, and we're constantly tweaking them to make sure that I'm in optimal brain health in those areas. It is huge. It made such a difference in my cognition. And we're, of course, always checking to make sure I'm not having any issues for blood clots. But that was literally because I was not moving because of all the surgeries that I had. So far I've been good. Of course, there's always that chance I could get one, but so far I've been really great, and I've been doing this for 6 years now. So anyway, hormones and cognition absolutely go hand in hand from my experience and what my doctors have taught me. So anyway, if you have any questions or you're looking for a doctor who can help you with those, reach out. We would be happy to suggest doctors, but a doctor that understands those things, that is really imperative. So you can go to our website, which is thenightofhope.com, and we can reach out to us and we can talk with you. So I hope that helps. I hope that you're having a great day. We'll look forward to talking to you soon.